Hi, my name is Chris Morgan. I am the adult programming librarian at the Newburgh Free Library, and thank you for joining us for Bridge Talks. Bridge Talks are community dialogues about topics that are relevant to our community. This series started as part of our Harriet Tubman Journey to Freedom program series. Bridge Talks have been on topics such as restorative justice, prison education initiatives, digital equity, inclusion, and literacy. And tonight's topic is going to be addiction and recovery resources in Newburgh and Orange County. We've got a panel of speakers from different organizations and nonprofits in Newburgh, Orange County, and the Hudson Valley. Got a great slate of speakers lined up. And they're all going to present on the topic of addiction and what their agency or organization does to address the topic of addiction in the community. So to get things started, I'm going to introduce our first panelist or panelists from Montefiore St. Luke's Hospital, Dr. Evan Cohen.
Thank you so much, Chris. Thanks for having us. I'm going to share my screen. And we have Kathy Sheehan as well, our Assistant Vice President of Patient Care Services, but I think she got stuck somewhere in the metaverse, so she can see and hear us, but she cannot participate and talk to us. So I'll kind of speak on her behalf. Again, I'm Dr. Evan Cohen. I'm the chairman of the emergency department at Montefiore St. Luke's, Cornwall. And I've been with the organization for about 2 years. We're in Newburgh. We see about a little under 40,000 patients per year, 130 patients per day. And, you know, I have some statistics on the opioid burden. Certainly alcohol and other drug addiction and overdose is really impactful for us as well. However, opioid is the overwhelmingly large player that, you know, causes harm for our patients. Just over the past 12 months, you know, nationally, over 100,000 drug overdose related deaths, and certainly in Newburgh and in Orange County, we have a disproportionate number of those deaths, about 1.5 times the state average, and I'm sure the same proportions hold true nationally. This is a problem that's getting worse. Over the past 12 months, the drug-related deaths are up about 30% nationally, and we're certainly seeing the same things locally. Obviously, multitude of factors, you know, into play there. Between synthetics and, you know, the mental stress, I think, that everyone's feeling. So, you know, we do have a multi-systemed approach to addiction and abuse and overdose. I think it really starts for us with education of our providers, our nurses and doctors, you know, learning to try to find alternative to opioid therapy for pain, you know, getting comfortable talking with our patients, you know, to try to identify if there's a problem. Every single one of our emergency department patients are screened for alcohol and drug addiction on triage, and it gives us an opportunity to connect them with services, even if, you know, that's not the reason that they presented to the emergency department. One of our more successful programs and partners has been the PRX program. If somebody comes in with a drug overdose or a concern for drug addiction or abuse, we can connect them with a peer, either telephonically or face-to-face in a rapid manner through the PRX system. And this does connect or gives them the opportunity to be connected with a peer of similar demographic and substance abuse background. They have connections with Independent Living, Onward Recovery, Catholic Charities, and ADAC. And the usage is up about 45% over the last year or two. And really good success with this program. We've been working with them for the past 2 or 3 years. You know, just in addition, and I think Kathy was going to speak on this, but I'm sorry, I'll touch on this later. Medication-assisted therapy. You know, I think that we have evolved in the emergency department as a group to recognize the importance of MAT. You know, really to be able to come off opiate addiction, you know, without assistance of MAT is an extremely uphill, difficult battle, and MAT dramatically improves the success rate. So We do have a handful of ex-waivered providers, myself included. And again, we have the opportunity to screen our patients and offer them MAT if they're interested and if they're candidates. We have integrated this into our electronic medical record order sets, triggers alerts to our case managers so that we can, one, start them on Suboxone if appropriate. We can bring them back to the emergency department if we're having a hard time connecting them at that moment for follow-up. And generally, we do have 24/7 case managers to get them those follow-up appointments. Obviously, on weekends, we will either bring them back or write them prescriptions to bridge them, and try to make warm handoffs to the appropriate referral, whether that's inpatient or outpatient, et cetera. And again, we've seen probably more success with the MAT than in my opinion, any other medication for drug abuse and addiction. Another successful program has been our Narcan Initiative. So anyone that either receives Narcan before coming to the emergency department, anyone that comes in with a opioid overdose or a concern for addiction will be offered free Narcan to them and or their families. This program also does help us to do some tracking. And in the past, I know there's been some successes in helping to identify tainted batches of drugs and help the police to prevent further overdoses. Hold on a second. And then, anyone obviously that is suffering from severe withdrawal, we can manage them medically in our hospital for medical management. And again, with our 24/7 case managers, we really do push to try to connect those patients that are interested and good candidates into, either continue outpatient rehab or therapy or inpatient rehab or detox. We really appreciate our partners, Resource Recovery Center of Orange County in Middletown, Arms Acres. I know there are more, I won't mention everyone, but we really appreciate those partnerships and have had good successes getting patients, right from the emergency department, right in the middle of when they're having that actual crisis, and they're most willing to get help, we find. So we're happy to take advantage of those moments and the resources that we have. And I'm going to stop share, and if anyone has any questions, happy to try to address.
If anyone's ask any questions, you can use the chat and I'll read the questions out loud, or you can unmute yourselves, feel free.
Hi, my name is Charlie. I'm from Independent Living, and I'm relatively new with the organization, but I have been involved with the PRX, and I just wanted to get a sense of the timing, the response. Are you satisfied with the response? We get a call over our cell phone and then we respond. I was just curious how that's working on your end.
I think it's fantastic. I think the biggest challenge is probably the language we use and encouraging and promoting the program. I think the people that are willing, we really have good success and connection with peers, and I know the app works well. We're trying to remind our providers, it's not just, hey, do you want this PRX thing? It's, we have this amazing resource that so many people, before you have found so helpful, and we'd love you to connect. Here's the phone, that kind of encouragement rather than passive mention. But, we found it's very helpful and very successful and works smoothly. And I know if Kathy could talk, she would agree.
Can you hear me?
Oh, there we go.
Okay, so I actually just want to jump in on that. And sometimes you can't measure your success, right? Like you don't know how someone's going to respond. And sometimes it's the planting of the seed when they have maybe a short conversation, or they just take down someone's phone number and then they think about it and they ponder and they pray, and then they make the decision to get in touch with someone either weeks or months later. And we do get feedback. So every little bit of connection that we make does give hope. So Evan, thank you so much for taking over. I had to use my little iPhone to get on, so my computer didn't work.
Good
But
timing.
yeah, it is. And thank you to the gentleman who's speaking up from Independent Living. You know, you're working with a great company. Sometimes we do struggle with the calls at night because we're not in a place yet where we're 24/7, but often in the morning, they'll follow up with our case management, and then we can connect them even after the fact. So, you know, it's all great work.
I actually work 12 noon to 8 o'clock. So sometimes I take some of those calls after 5, or Danielle's also with us here tonight from my organization. I know she does the same. I just wanted to say, to your credit, that the staff interaction I've had from your organization has been fantastic. So I just wanted to mention that.
That's excellent to hear. We're so glad. You know, we want everyone to have, you know, warm hearts, warm hands, and it's all for the good of the people. So thank you. I'll pass it on.
All right, well, if there are no further questions, I'm just going to pass things over to Lindsay from Newburgh City Drug Court.
Thank you again.
Good evening, everybody. I'm just going to let me share my screen here. Okay, so my name is Lindsay Frusciante. I'm the resource coordinator for the City of Newburgh treatment courts. I have been working at the courts for about 6 years, and as you know, as we know, we're talking about addiction. Many times, the individuals that our agencies are working with are become criminal justice involved. And that's kind of where we come in. I'm going to talk about all of the courts, not just the 3 courts that I preside over. There is a wellness and recovery court that the Orange County and the court system, collaborate with. And so I did provide some information here on this slide. And if you guys need any more information, please feel free to reach out to myself or Ray Rodriguez, who oversees the wellness and recovery court. The reason for these courts is to help those individuals get connected to community resources, no matter what they're struggling with. Particularly the Wellness and Recovery Court, focuses on individuals who are involved in the criminal justice system that have severe and persistent mental illness. It's, treatment-based alternative to them, going back, dealing with the judge to, possibly face incarceration or other alternatives. So this court is really, all these courts are really important in providing these individuals with the assistance to remain in the community, get the help that's needed, and stay out of the criminal justice system. These focuses are, to decrease recidivism, and as we look at our statistics, that is in fact what we're doing. So all of these courts have treatment teams. We all work collaboratively. Some of them, the teams look a little different, but Ray and myself, who are the coordinators of these courts, work collaboratively on a day-to-day basis, providing assistance to each of our courts. Every one of the individuals in our courts struggle with some form of mental health issues, and we address those in every single one of these courts. The Wellness and Recovery Court is based off of, particularly identifies with the individuals who have the mental illness, whereas Drug Treatment Court is more focused with the substance abuse services or the substance abuse issues that an individual is dealing with. We address the mental health, but if their mental health is more severe, then we can refer them to the Wellness and Recovery Court. We also have the Veterans Treatment Court. So, veterans who are coming home or, from serving currently, who have struggled in the past, with service-related injuries, TBIs, DWIs, substance use, there's a veteran-focused programming that occurs in our court. And these courts are expanding. We're finding that there more and more are being created, especially with new legislation that has come out in, I believe it was last summer. New legislation came out saying that if a veteran in the criminal justice system was eligible for a veterans treatment court, and there was not one in their county, that those cases could be referred to an adjacent county that does have a veterans treatment court. So I believe right now, like Ulster County does not have a veterans treatment court, and there is a case that has been referred to our court because we have one. So, you know, with that legislation that has also come out, our district, the 9th Judicial District, which covers 5 counties, if there is not already a veterans treatment court in that county, they are being created. Currently in Orange County, the city of Newburgh, the city of Middletown, we have veterans treatment courts or veterans tracks under our drug courts that are turning into veterans treatment courts. And that's on a misdemeanor level. And there is a county drug court, which is also going to be creating a veterans treatment court on a felony level. So Orange County is very well ahead in what we're going to be doing in order to help the veterans. One particular court that was started about 2 years ago in conjunction with OASIS and the SAMHSA funding, was the Opioid Intervention Court, and that started about 2 years ago. And it originated in Binghamton, and they've kind of spread out through all of the state. The opioid court is providing immediate intervention and treatment supervision to individuals who are at risk of an opioid overdose. Again, this is all based on self-disclosure, what they choose to communicate to us. And it's pre-arraignment. So we're trying to get them right after arrest, get them connected to services within 24 to 48 hours. They do not, they don't sign a contract for our program. It's more of a harm reduction model. Let's get them in, get them connected to medication-assisted treatment, get them connected to inpatient, outpatient, whatever is needed, get them connected and monitor them over a certain period of time. And then maybe they get to transition into our courts. But the whole point is to help individuals, you know, prevent a fatal overdose and prevent any overdose for that matter. So we work with various agencies in the community and outside of the county as well to help with this court as well. I think I said before that we have a very treatment team-based approach. All of these courts work with the community-based services. We don't just focus on the substance use or the mental health. We focus on, you know, connecting them to resources in the community for job placement, education, you know, if they need housing, food, just, you know, every aspect of their life, not just the substance use or mental health. We treat the person as a whole, just as if they were, you know, in, you know, restorative management, Catholic Charities. You're treating the whole person, and the issues that are surrounding part of the reason that they are involved in the criminal justice system. One of the biggest pieces that have been really important over the last year with our court, and we had a great peer support for the last 5 years, but we recently got more grant funding, and our grant funding has provided a peer support in all of our courts. And his name's Manny Gonzalez. He works under independent living, and he sits with our participants in court. He provides them support, connection to resources and community, provides that peer interaction that myself and other coordinators or the judge or the attorneys, ADA, that, you know, we can't provide that. And Manny does a great job of providing that support to each of our participants. He, when able, has been able to transport individuals to treatment if we can't get them a ride directly to treatment. And that has been a big success in the transition. You know, many individuals who are in the throes of their addiction are, you know, not going to sit in a cab, Medicaid cab, you know, all the way if it's like 45 minutes to treatment. Might detour, might change their mind, and Manny being there as a peer support, you know, to talk to them and just encourage them and give them that support has been extremely helpful. You know, with that and with bail reform, we have also provided peer support in the local town courts. Right now we're in this town of Newburgh, and we're hopefully going to be transitioning to another court as well. We can only expand or spread Manny to so many different places. But currently he sits in the town court and provides support to any of the individuals that walk in that courthouse who might need support and connection to community-based services. And it doesn't necessarily mean that those individuals are going to be coming to our courts. You know, we want those individuals, you know, in the outerlying county, you know, to get the support and services they need, and they might not get that support if there's nobody there to kind of help them along in the process. All of our courts are what are called hub courts. So you'll see, as I wrote, that each court is a hub court. What that means is that any individual who has a case in any of the town or village courts in Orange County, and who are eligible for our program, those cases can be transferred into the City of Newburgh Drug Treatment Court, or even into the City of Newburgh, City of Middletown treatment courts. So all our courts in the City of Newburgh are what are called hub courts. So any cases, you know, a case in Port Jervis could be transferred over to our court. So we are trying to serve everyone in the county to get them, you know, services and help that are needed. Most individuals who enter the court have their cases, and any of the courts here have their cases dismissed at the end. They receive an ACD, adjournment in contemplation of dismissal, or they have reduced charges. So many of our veterans who enter with a DWI charge do get reduced charges at the end. So all of that information is dealt with at the very beginning of court. At the very beginning of the program, when they sign a contract. So they are fully aware as to what they're signing, what their outcome will be if they are successful or unsuccessful. Aside from the opioid intervention court, all of the treatment courts are a minimum of 1 year. And there are various different phases that the individuals have to move through in order to graduate. Each of those phases have different requirements and various different goals that they have to fulfill in order to move on. And it's, you know, something that we've kind of started to encourage them as well, obviously with how things have gone with COVID. You know, we've encouraged them to try and get back out into the community, going to, you know, to more meetings that are in person, getting more involved with community resources and services as well, to the best of their ability. As we know that many of our participants, you know, not having that face-to-face in-person interaction during COVID was very challenging and set them back in their recovery process. So since being back in person, we have seen improvement in the participants' interactions with us, as well as, you know, getting back out there into the community. One thing I think I missed was our veteran mentors. You know, just as we have peer supports in the other courts, and our peer provides support in our Veterans Treatment Court, but one of the key things that we have in our Veterans Treatment Court is veteran mentors. These individuals are volunteers. They do not get paid for what they do. They come to court weekly. They provide support to the participants, a camaraderie that many of us cannot provide to them. And the mentor coordinator also provides a therapy dog. He has his dog that he brings to court, and it really brings a sense of calmness to our veterans who, are standing up in front of the judge, maybe had recently relapsed or, just had a negative experience in general, going through some trauma issues. And that therapy dog being there, helps calm them down and be able to communicate with the judge and the team. So that is something that's really been great in having that as a part of our court in the last few years. I think I kind of I went over everything. I don't know if there's any questions. I know it kind of went through that a little fast, but there's just so much information about our courts that I can't tell you it all in just 10 minutes. But if you have questions, or if you'd like more information, or you'd like to see a graduation or come to one of our court hearings or any of that, you are more than welcome to reach out to us and do so. The judge would be more than happy to have you there, and we want you to see what we do and how we can support the services in the community as well, and have a great collaboration. So I'm not sure if there was any questions or anything, comments.
If anyone has any questions, please feel free to type them in the chat and I'll read them, or feel free to unmute yourselves and ask them. All right, if not, I am going to turn things over to Tammy, who's with the Orange County Department of Mental Health. Oh, I'm sorry, Tammy, you're muted. I can
All good. I'm actually switching from my phone to my computer at the same time because I've been having phone or computer issues too. So I apologize as I do this. So I'm not going anywhere. I'm just switching devices. Hold on 1 minute.
Sure.
Okay, 3 times the charm. How can you hear me?
Yep.
Hi there. Okay. Wow, technology. I'll tell you, I learn something new every day. And hi, Colin. I couldn't even respond to you. It's always great to see you, my friend. So I can't bring up my slide, but I'm at least on a video where I can see all of you a little bit better. So thanks, Chris. And oh my gosh, thank you, doctor. Thank you, Lindsay. So many of you I work with on a regular basis in my role at the county. And that's really what I'm here to talk to a little bit about tonight. For those of you that I don't know, my name's Tammy Rhein. I work for the Orange County Department of Mental Health. So oftentimes when you hear, like Lindsay was just talking about the county, that's kind of us. In particular, our office, because we oversee all the behavioral health services. So that includes not just chemical dependency, but also developmental or intellectual disabilities and mental health services. What that means is that under mental hygiene law, my boss, Commissioner Miller, is designated as what they call the DCS, the Director of Community Services. And that is required under mental hygiene law to have one of those positions in every county in New York State. Of course, the city's a little different. They have a little different titles from county to county, but there is somebody like her and similar to our office in every county. So we are county government. Our role under mental hygiene law and really is twofold in our office, because that's our primary role, is what we say the local government unit. So we're part of the Orange County government system. but we also provide direct services, and not every county office like ours does that. So that's the twofold role. The easier piece of the conversation is that we provide 2 clinics in Orange County, one of which is the Children and Family Clinic right off of Broadway that I'm sure a lot of you are familiar with. It's been there for quite some time, many, many years, and it's in the building right on Broadway that has a lot of the county services in it, like probation and social services and so forth. So we serve as young as, I think, 4 years old, and I think the oldest I have known of was 99. So we serve the gamut of individuals. Our primary license is by the Office of Mental Health, but one of the things that's very critical to my job in recent years is that I truly believe that nobody really comes with a substance use disorder or impairment problem without some kind of mental health complication, right? So I share that because it's still a ongoing evolution, I would say, for all systems, whether we talk about hospitals, whether we talk about direct care providers, to understand that people come to us with complexity. And that's really where our mission and our vision come in Orange County. We, as some of you are aware, we work under an umbrella that we refer to as Welcome Orange. And that is a group of providers. It is open to anybody that wants to join it from Human Services that identifies as a quote, Welcome Orange agency. So any meeting that we have is called a Welcome Orange meeting. And the umbrella is something that we actually write into all of our contracts with providers, that the expectation is that we will be welcoming, culturally responsive, trauma-informed, person-centered, you know, working with peers and in that person-centered approach and meeting people where they're at. So it's a big umbrella, but it's really critical to the work that we do, not just in clinical and treatment, but in the prevention world and in the recovery world, right? And this conversation tonight is about the continuum of care. So that's a little bit about our mission, twofold, right? As an agency, we provide direct services. The other clinic that we have is in Port Jervis, does the same exact thing that Newburgh does. They actually have a larger census, just meaning that they serve about double the capacity currently. You know, it's about where the need is, I guess. And Port Jervis doesn't have as many services as the Newburgh area does. So our clinic tends to be a front door to a lot of the folks that are looking for help. The other role for us, as I said, is the local government unit is really our primary job. So we serve as the liaison between the state offices of OASIS, mental health, and OPWD. My job in particular is to oversee substance abuse services for the county and adult mental health. I wear a lot of hats, as some of you know. I'm also serving as the project director for the Healing Community Study, which is a very large multi-million research study out of Columbia University. And we are happy and excited to be a part of that process. We are one of 16 counties in New York State that are participating in that research study around opioid use disorder. So there's a number of other titles that I wear, but primarily these days, as Dr. said early on, Cohen, that so much of our work is consumed with the opioid epidemic and has really been for the last 10 plus years, you know. So let me just take a breath and think about this a minute. There's so much that we do. And really what I like to say is that our job, and this is kind of outlined in the mental hygiene law, our job is to provide for the continuum of care, right? Is to plan for the service continuum. So what does that mean? It means I'm constantly looking, and we in our office are constantly looking at prevention, treatment, and recovery in all of the areas that we oversee or support. What's needed, what's missing, where are the gaps? Is it funding? Is it staffing? What are the burdens? What are the challenges? What are the successes? And probably the thing that would be most critical for me to talk about tonight is our Orange County Crisis Call Center and some of the ongoing collective work that we've done with local police departments and police chiefs, as well as many, many providers. Certainly St. Luke's is, you know, a game changer in the beginning. And, you know, our mobile response team and our call center. If you're not aware, we opened a 24/7 call center back in 2019. It's hard to believe that we're going on 3 years at this point. We have always had some kind of mobile response for 30 years. Actually, this past year, it was 30 years. It wasn't always full time, but we've had 24-hour, 7-day-a-week response for many years now. We have employed or supported peers for many, many years now. I do believe that we are ahead of a lot of other counties, and some of the work that we do, and peers is one of those examples. And as you know, with oh my gosh, I forgot your name, the gentleman that spoke earlier from Independent Living. I'm looking at your picture there. Is it Charlie?
Charlie, yeah.
Charlie. So welcome, Charlie. We haven't met yet.
Thank
but,
you.
Certainly agencies like Independent Living, who are, you know, a mover and a shaker, not just in Orange County, but at the state level, have helped to lay that groundwork and the value of understanding what peers bring to the table. We've also had some kind of warm line. We have been removed from calling it a hotline because there are certain regulations and requirements to calling something a hotline and a crisis line. But MHA for about 25 years has also operated a warm line. So in 2019, what we did is we had been taking a look at our continuum, as I said, and asking the question of what's working and what's not. And as you probably know or can imagine, police officers and police departments are some of the first folks to tell us everything that's not working. And we have done a lot of work with our local departments to really bridge those relationships and to bring them into the fold. And what I mean by that is training them on crisis intervention team practices. How do you engage somebody that's in some kind of emotional crisis, whether it be due to being intoxicated or under the influence or withdrawal, or somebody that's having potentially a psychotic break, or somebody in crisis because of a developmental disability. So that falls under my purview too, when I serve as the CIT lead for the county. Currently, we have about 10 police departments out of, I think it's about 35 in Orange County, that are active quote unquote CIT departments. Means that they have CIT officers on board, a coordinator, they meet with us regularly, and are involved in a pretty in-depth process. City of Newburgh is definitely one of them. Town of Newburgh and Town of New Windsor are probably our three most active departments. City of Newburgh was the first department to come on board, and I think that speaks volumes. Even though through all the changes of administration, they have continued to stay committed, which is a wonderful thing. So that crisis continuum, what we found was the district attorney's office, community members, parents, families, police officers were saying there's a disconnect. It's fragmented and it's very difficult for us to access services, right? Which is something that we typically hear. We also know that people don't really ask for help until they're really in super crisis, right? And oftentimes it's easier for us to go to somebody that we feel comfortable and safe with versus cold calling an agency. We don't know who we're talking to. We might even not know the question to ask. So we find ourselves being investigators and trying to kind of predict those questions for people. So when we opened the call center, we spent about a year working towards that, meeting every week with all of the stakeholders. You can imagine that was pretty intense. And I share oversight of the call center along with Darcy, our commissioner, and our administrative team, Lacey Trimble, our deputy, and so forth. So what we did is we co-located all three of those services, the mobile response team, the peer services, and MHA, who operated the one line. We co-located them at the Emergency Operations Center, because what better place for them to be but rubbing elbows with 911 callers, right? So it has been a humongous learning, and we learn as we go. It's been a wonderful experience, but lots of challenges that we could have never known. And I'll just give you the most significant one that we've battling for at least a year is what 911 call takers are allowed to talk to us about. We often are the ones saying confidentiality. In the substance abuse world, there's 42 CFR. It's very difficult for us to share details, but when somebody is in crisis, we have some more leverage as people that work in this field, and we can share a little bit more about that. So even though we're co-located, we're still battling some of those barriers about who can share what to. Like, they literally can't transfer us a call, even though we're sitting right next to them. But that's part of our goal. And I can tell you that when we opened the doors of the call center in April of 2019, we looked nationally at every model that was out there. We found one potential model in the state of Texas that was somewhat similar to what we did. And again, I think it's a testament to our county that, you know, and all the providers and partners, that we often are doing the things that are much more forward thinking. So at times we hit some of those barriers first, right? And we really, I said this to somebody today, and it is a true philosophy for us in our office. We don't ask ourselves, what funding do we have available? We ask, what is the need? And then we find the service and the funding. And I think that's the motto that we try to live by. If there is a gap, and here's another example, with COVID in recent years, we have seen a tremendous upsurge in youth struggling, really struggling, dysregulated, visiting the ER on a regular basis, 3-4 times. I mean, the amount of 15 and 16-year-olds coming through the emergency rooms is astronomical. So it begs the question, what can we do different, right? We know that there are barriers around child psychiatry. We know there are barriers around the legalization of marijuana and synthetic drug abuse on the street. But what can we do to help engage those kids sooner in the process so that they don't develop a full-blown addiction or chronic mental illness? And so those are some of the things, like as of recently, we're looking at, right? So that call center is kind of our baby in the last couple of years. Everything we do kind of centers around that these days, crisis work. In our office, there are a number of other programs that we run. We work very closely with social services. We have a lot of specialty programs for kids that are being removed from parental custody due to addiction, for kids that are being abused and being removed for that reason. We have a WOGI program that stands for Welcome Orange Geriatric Initiative. It's a specific funded program, originally started with grant funding and now through the Office of Mental Health, that serves 55 and older. And actually Independent Living is going to be providing the peer for that. So, again, a robust, we're targeting a population that's often very at risk for overdose, for isolation, for suicide, for all kinds of things, right? But it needs to be targeted. And I could probably go on too, but like I said, our main thing is local government unit, oversight of the system, serving as a liaison between the state offices and the local continuum. We do manage a majority of the contracts of funding that licensed providers get. So any OASIS licensed provider that receives deficit funding from the state or the county comes through our office and we contract with them. We, monitor that data, the metrics, and are in constant conversation with folks about the services. So let me just take a breath there and ask if anybody has any questions. And hey, Leilani, I'm looking at people's names that are seeing now. How are you?
If anyone has any questions, please feel free to unmute yourselves, or you can share your question in the chat field.
And Chris, can I just say it's nice to put a name to the face? I think we've spoken a number of times, different events, and I had no idea.
Yeah.
I'm like, how funny is this?
Yeah, I think we've collaborated a few times before.
Yeah.
Well, thank you so much.
You're welcome.
If there are no questions, I'm going to pass things over to Leilani.
Hello, and hello, Tammy. Thank you so much for having me, everyone. Thank you for the wonderful presentations that have been made thus far. So I'm going to quickly share my slides so that we can get this little party started, or it's already been started, but on my end, for my part. So my name is Leilani Yizar-Reid, and I work for the New York Council on Problem Gambling, and our program is within the Mid-Hudson region. So we are the Mid-Hudson Problem Gambling Resource Center. And this little short slide is about the hidden addiction and how we can connect people to care. I really appreciated Tammy for saying people don't come to us until there's a crisis, and that's similar to gambling addiction. Is that because a lot of people don't know about this addiction. It's one of the lesser known, but we are really trying to get out into the community and raise awareness about what we do, why we do it, and why we're here. So again, our mission is always to increase public awareness around problem gambling and connect clients to services and treatment. And at all times, at the end of the day, New York Council on Problem Gambling, we're neutral to gambling in general. We can't tell people that they should not gamble. We just encourage them to say, if there is a problem, please come to us. Please come to us and receive some services and get help. So how we define gambling is risking something of value at a chance of reward. And that at the end of the day is full-on gambling. Risking, and value could be money, it could be possessions, it could be your house, your mortgage, it could be your savings, whatever you consider of value, that and you're willing to risk it for whatever reward that may be, that is gambling. So what we do know about gambling addiction is that it affects everyone. There's not just one population it affects. It's not just one group of ethnic people that is affected by it. Every person on this God green earth is affected by gambling. So over 70% of those with an alcohol disorder have a problem with gambling. Over 38% of those with drug disorder have a problem with gambling. And over 60% of those with a nicotine dependence have a problem with gambling. We also see that 2/3 of persons with a gambling addiction have reported that their mental health has suffered. And we also understand that for over 41% of those with a gambling addiction have anxiety. We also, some other stats for you, 2/3, and this is kind of related to the presenters that have come up before us, is that 2/3 of our gamblers, 33% of individuals incarcerated are affected by problem gambling, and 40% of the prison population have engaged in gambling behavior. We consider like the flow of how one goes from being a person who social gambles to a person who is at risk and it turns into a problem to the person who has the addiction, is we consider it the hook, the hobby, the habit. The hook is, okay, and if we're saying right now, the big topic right now is online sports betting, right? The hook is there's advertisement out there. There's a lot of advertisement and it is looking very enticing. The access to it in terms of, or the what do they call it? How they're endorsing people to come in and purchasing, like, okay, I'll give you $400 or 400 points or credits if you download our app. That is the hook. That's how they're hooking you. They're giving out incentives so that people can join and people can start using their platform to play. The hobby is that you're now playing every single day, because you may have won one or two times and now you see, okay, I'm getting a little bit more money, and maybe I've lost a little bit, just a little bit, but I can always gain more. So that is the hobby. You're playing it every single day or every other day. Now the habit is, it is every single day. You're constantly watching your phone to see if whatever team won, whatever you placed a bet on, if you have won any money. That is the habit. That's where the addiction really comes into play, because now you're unable to stop. You're unable to stop looking at your phones. You're unable to recognize when you spent too much because of the cashless transactions. There's so many ways somebody can get hooked to the habit. So with the launching of mobile sports betting in New York State, the Gaming Commission announced 4 approved sports books, which is FanDuel, Caesars Sportsbook, DraftKings, and Bet Rivers, I believe. And that was launched on January 8th. And there's still about 5 other sports books arenas that are able to, or sport books that are going to come into play in the later year. So I'm going to show this quick little video just to show you, I don't know if anybody else has seen this, in the first 36 hours of sports betting being legalized, how many people have checked in on the first weekend of the legalization of online sports betting. And that's just people checking in throughout the day, people placing bets, and you can see how much it has grown in the lower part of the state, which is our region, the Mid-Hudson. It is New York City. It is Long Island. So right now, on the day it was launched, 5.8 million people participated in online sports betting, which in comparison to 2.3 million in Pennsylvania on their first weekend of legalizing online sports betting, and also compared to 2.5 million of those in New Jersey. And what New Jersey and Pennsylvania has seen, in Pennsylvania, their helpline has increased, and over 50% of people in New Jersey are now seeking treatment for problem gambling, gambling addiction. So at the end of the day, what do we do as a PGRC? We provide trainings, obviously continue education, and we do offer credits. Our Problem Gambling 101 offers OASIS credits and social work credits. And our other trainings like emerging trends or problem gambling and suicide, problem gambling and problem gambling with individuals with intellectual disabilities, problem gambling and domestic violence, problem gambling and comorbidity. We offer an array of topics to provide to you as the community to educate you on how it is affecting these various different communities. We all are always gathering information from community stakeholders, and right now we're really focusing on listening sessions with community members and really trying to figure out what is their perception of gambling within their community, so that we can then take that information back to say, okay, we need to go this direction, we need to go that direction, because we could think of things, but it's best to hear from the people and what they need. We also work with community-based organizations like yourself to refer individuals to care. So if they're in need of housing, if they're in need of different mental health facilities, if they're in need of different things within a community, we partner with our community organizations. And so for our treatment side, our PGRC clinical network we have a great clinical network in the Mid-Hudson region. We have onboarded a group of licensed counselors who specialize in problem gambling. We also refer people to our support groups. We are familiar, and we do great work with Gamblers Anonymous and GA and Gam-Anon. They are actually having their open meeting, I believe it's March 6th. If you are interested in learning more about that, it's an open meeting. Any person can attend to learn more and more about Gamblers Anonymous and Gam-Anon. We encourage you to go to that. And if you want more information, please reach out to us. There's also family groups, and we do also make referrals to Smart Recovery. I want to go back to our clinical network. Our clinical network right now, because of COVID and the pandemic, a lot of people have switched over to virtual therapy. But prior to that, we have clinicians in every part of the Mid-Hudson. And the purpose of that was we didn't want our clients to have to travel far to seek therapy. We try to make sure that there are no barriers to care. And another way that we try to make sure that there are no barriers to care is by, if they are not unable to pay for their therapy, the organization covers the cost. So we really want to just at all costs connect people to the care that they deserve. We also we also allow, or not even allow, people who are, it's not just for the problem gambler, it's also for the loved one. So if there is a spouse who is struggling dealing with the problem gambler's addiction, the spouse can call in and say, you know what, I need therapy too. How can you help me? We can connect them to our clinicians. So lastly, there is self-exclusion. We provide information about casino self-exclusion in New York State. The individual has to go to the casino and say, hey, and fill out their information. They can make sure that they don't step foot into the casino and they're saying, I want to self-exclude. I want to make sure that you know that I can't be here. I don't want to be here. I want to put myself in a position where I'm well, I'm healthy, and I want to stay away from my addiction, so that we provide that information about self-exclusion to our clients. So where to start, and this is something for you. You can provide e-screeners in your organizations or wherever you work. We have also a online you can provide screening tools, but we have an online screening tool on our website, and you can add questions to your assessment, however your initial intakes about problem gambling, asking people simple questions as to, have you ever placed a bet? When is the last time you placed a bet? And oftentimes people are not going to often disclose if they have, but it really is about having a conversation with them just to gain more and more information. And eventually you can possibly guess or figure out, maybe this person does have a problem. You can refer them to us and we will gladly answer the call and connect them to wherever they need to be. Whether that is speaking to our clients, if they're more comfortable going to GA or Smart Recovery, or if they need more intensive treatment, and we can refer them to our inpatient partner facilities. So this is a image of our e-screener. Obviously, you can go to the QR code and it says scan me, and the individual can scan it, ask it will answer a few questions online. And then here is an image of our brief biosocial gambling screening. Again, it just answers asks three simple questions as to, when was the last time you gambled? Do you feel restless when you do gamble? Are you having financial trouble in your home or in your life that is as a result to gambling? And lastly, we have a podcast. It's called the Hidden Addiction Podcast. It is on Apple, Anchor, Spotify, Google Podcast, and we're in our season 2, and there's a lot of great information on the Hidden Addiction Podcast. We have had guests in recovery. We've had guests to speak on the veteran population, the LGBTQ population, domestic violence. We've had an array of topics, and we are going to continue to have an array of topics in our season 2. And we are really excited about what we have in store for this year. So at the end of the day, here is our contact information, and that is it. That is it.
Thank you so much. If anyone has any questions, please feel free to unmute yourselves and ask, or you can ask them in the chat.
I'm just curious, and looking at that video, it seemed like the concentrations were in the cities throughout the state. So on the western part of the state, it looked like it was Niagara Falls, Buffalo, Rochester, and then in New York in the Hudson Valley. Is there any reason for that? Why it's so heavily concentrated in the cities?
I think right now we don't have any statistics. I can't really say as to why more people are betting in those different areas. I can guess why it is, people have more access to the internet. It could be that internet having bandwidth to have the tools to look at it, to utilize and experience online sports betting. That could be a reason, but I really don't know the exact answer as to why. I did want to bring up something that you had kind of jogged my memory, but I can't remember. That had to do with online sports
Do you
betting.
think that's an accurate assessment, though, that it's more concentrated in the cities than it is in the rural areas?
It was just based upon the geomap. It just showed that at that time, that's where people were placing bets. And within that first weekend, that doesn't mean that in after that first weekend, more and more people weren't placing bets in other spaces. But it just captured that moment at that time.
Well, thank you.
I wonder, Leilani, this is Tammy. I wonder about a couple of things. With addiction in general in the more rural areas where they don't have as many, could be economic opportunities or social opportunities, something like gambling or using tends to be more prominent. The other thing that strikes me is all the Indian reservations as you start to go more upstate and some of the access.
Yeah, right now it seems that the other locations that would possibly could be given that sportsbook license is in the other areas of like the other parts of New York State, like Resorts World, which is in the Catskills. They may be getting the well, I know Resorts World in general possibly maybe get the license, and you might start seeing more and more there. But more and more information will come out towards the end of the year. I know that across New York State, when the legalization of online sports betting came out, we did receive across New York State, we received a lot of calls. There was a great increase in calls, and not just for those who are who their gambling of choice is sports betting, but it was for the casinos. It was a variety of gambling types. And then within our Mid-Hudson region, what we also started to see is that more people, it wasn't just the loved one calling, because before we were getting a lot of calls of loved ones calling, but now we're actually getting the gambler, and that is calling in for services. So and we think a lot has to do with the advertisement that has been coming out. And when you have more access to it, and when a lot of things are exposed, the more you're more inclined to want to even start again. And then there's some clients who also are coming back into treatment and wanting to receive more treatment because they're triggered.
It's incredible the amount of radio advertising and how enticing it is. They almost make it sound like you can't lose.
Yeah, and especially if you're handing out credits, like free credits. Join, download my app, and you can have these free credits just to start start the gambling. And I don't know if you even noticed, even prior to, even during the pandemic, there was an increase of advertisement with the lottery system. They had a whole array of nostalgic type of advertisements, commercials coming out saying, "Welcome back, New York," because people were going through a lot of stuff during the pandemic. So just to lighten up their mood, let's bring back the whole old New York feel. and buy lottery tickets, put it in your stocking stuffer, do all these things. And we also want to remind ourselves that, you know, there's a lot of youth gambling too. And gambling, just like just like alcohol, there's a legal age to it. But they're not looking at the youth. They're looking at the adults, but the youth are gambling as well.
Thank you so much.
I just want to add, I'm so sorry, but March 9th and 10th is our annual conference, and you can contact us or go to our webpage and find all the information. We just put out our save the date. It used to be in the fall, but now we're moving it to March, which is Problem Gambling Awareness Month. If you want any more information, training, whatever, but March 9th and 10th is our annual conference, and please join us.
Thank you. So I'm going to turn things over to Dennis, the Public Information Chair with Orange County Alcoholics Anonymous.
Thanks, Chris. And I want to thank all the panelists who participated in helping people find a pathway to recovery. My name is Dennis, and I'm a proud member of Alcoholics Anonymous, and I have the opportunity to serve as the Public Information Chair for AA in Orange County. Some on this video may not be familiar with our anonymity process. There are some of you who may be, but our tradition of personal anonymity at the public level is because it's based on attraction rather than promotion. And that's why, very simply, my last name has been omitted from my designation on the Zoom meeting. I'm here very simply because I got an opportunity to meet Chris. And Chris, I do want to thank you again for the invite here. Because as the Public Information Chair, our committee is tasked with something really very basic. And that is to provide information to the public about what Alcoholics Anonymous is, what it's not, and how to reach AA, and some of the resources that are available through Alcoholics Anonymous. Alcoholics Anonymous is an international fellowship, and the simplest way to let people know what AA is to read the preamble that we read at every AA meeting. Alcoholics Anonymous is a fellowship of people who share their experience, strength, and hope with each other that they may solve their common problem and help others to recover from alcoholism. The only requirement for membership is a desire to stop drinking. There are no dues or fees for AA membership. We're self-supporting through our own contributions. AA is not allied with any sect, denomination, politics, organization, or institution, does not wish to engage in any controversy, neither endorses nor opposes any causes. Our primary purpose is to stay sober and help other alcoholics to achieve sobriety. And despite the fact that I know I can recite that verbatim from memory, I read it every time I need to, because it's important for me to always be able to convey what AA is. In that regard, how does AA work and how do you contact AA? And I'll put the contact information in the chat for our local area intergroup at the end of my share. A lot of people first come to AA by contacting a local area intergroup in their area. And as I alluded to before, AA is international in its base. So in every area of the United States and many places internationally, you will have a local area intergroup like we have here in Orange County. In Orange County, our website is orangenyaa.org, where you can go to contact Alcoholics Anonymous, and where you can go, more importantly, to find out about meetings that are available. And there are meetings available to almost 24/7 worldwide. But in Orange County, there are